Welcome to this video on epidemiology and community health nursing. We will study the distribution and determinants of health and disease, covering key concepts relevant for exams like NORCET, RRB, ESIC, and DHS. Remember the powerful quote, "Prevention is better than cure." Hard work will help you reach your goals, possibly faster than relying on good luck. What is epidemiology? The term is derived from EPI, meaning upon, demos, meaning people, and logos, meaning study. John Last defined it as the study of the distribution and determinants of health-related states in specified populations, applied to health problem control. According to the International Epidemiological Association, the aims of epidemiology include describing the magnitude of health problems, identifying risk factors, and providing essential data for planning and evaluating health services. The epidemiological triad illustrates that disease results from the interaction between three components: agent, host, and environment. The agent is the cause, the host is the affected person, and the environment covers external factors. This slide illustrates the natural history of disease. It generally progresses through pre-pathogenesis and pathogenesis stages, which include primary, secondary, and tertiary prevention efforts. The iceberg phenomenon of disease shows that only a small portion, the floating tip, consists of clinical cases seen by a physician. The large submerged portion represents the hidden mass of latent, subclinical, or undiagnosed cases. Examples include hypertension and diabetes. Here are some quick one-liners for review. John Snow is known as the father of epidemiology. Hippocrates was the first epidemiologist. Diseases like rabies and measles have no iceberg phenomenon. Determinants refers to causes or risk factors. The tools of measurement in epidemiology include rate, ratio, and proportion. A rate measures occurrence over time. A ratio means the numerator is not part of the denominator. A proportion means the numerator is part of the denominator and is often expressed as a percentage. Morbidity indicators include incidence and prevalence. Incidence measures new cases and is used for acute conditions. Prevalence measures the total number of cases, both old and new, and is used for chronic diseases and planning. The correct answer to the question in the previous slide regarding new cases of COVID-19 infection is incidence. Mortality indicators include crude death rate, case fatality rate, which shows the killing power of a disease, proportional mortality rate, and survival rate, often used in cancer prognosis. Epidemiological study designs are broadly categorized into observational and experimental. Observational designs include descriptive and analytical studies like case control and cohort. Experimental designs include randomized controlled trials, which are considered the gold standard. Descriptive epidemiology, the first phase of investigation, describes disease distribution by time, place, and person. The outcome of this phase is the formulation of a hypothesis. The case control study is retrospective, starting with diseased cases and healthy controls to find exposure history. It measures the odds ratio and is quick, cheap, and good for rare diseases. The cohort study is prospective, starting with exposed and unexposed groups and following them to see who develops the disease. It measures relative risk and is best for establishing causality, although it is often expensive and time-consuming. The randomized controlled trial, or RCT, is the gold standard for clinical trials. Randomization eliminates selection bias, and blinding eliminates observation bias. Blinding can be single, double, or triple. Let's review some key study concepts. The odds ratio is calculated in case control studies. Relative risk is calculated in cohort studies. Case control studies are best for rare diseases. Randomization is the heart of an RCT. Association means two events occur together. Causation means one event is the result of the other. The Bradford-Hill criteria, including temporality and strength of association, are used to judge causation. There are 4 levels of prevention. Primordial prevention prevents the emergence of risk factors. Primary prevention acts before disease onset. Secondary prevention halts disease progress. Tertiary prevention reduces disability and impairment. Primordial prevention focuses on discouraging the development of risk factors, targeting the total population or children through health education and lifestyle modification. An example is teaching children not to smoke. Primary prevention aims to prevent disease occurrence when risk factors are present. This includes health promotion, like nutrition, and specific protection, such as immunization, wearing seatbelts, or using contraception. Secondary prevention focuses on halting disease progress and preventing complications through early diagnosis and treatment. Examples include all screening tests, such as Pap smears, and treatments like DOTS for TB. Tertiary prevention focuses on reducing impairment and disability. This includes disability limitation and rehabilitation, such as physiotherapy after polio or reconstructive surgery for leprosy. Regarding the question about the level of prevention for a Pap smear, the correct answer is secondary, as it is an early diagnosis screening test. The question asks about the level of prevention for wearing a helmet while riding a bike. The correct answer is primary, specifically specific protection. Screening is the search for unrecognized disease in apparently healthy people, detecting the submerged portion of the iceberg. Sensitivity is the ability to correctly identify those with the disease, while specificity is the ability to correctly identify those without the disease. This slide summarizes key terms related to disease frequency, including incidence and prevalence, which are fundamental to epidemiological analysis. The investigation of an epidemic follows a specific order of steps, beginning with verification of diagnoses and confirmation of the epidemic's existence. Key steps include data analysis by time, place, and person, and the formulation and testing of a hypothesis. Modes of transmission are classified as direct or indirect. Direct transmission involves contact, droplets, or transplacental routes. Indirect transmission uses vehicles like water, vectors like mosquitoes, or airborne particles. Important time intervals include the incubation period, the time from agent invasion to the first symptom. Generation time is the interval until maximal infectivity. Serial interval is the gap between the onset of the primary and secondary cases. This slide lists various immunizing agents or vaccines used in public health. Vaccines are critical tools for specific protection in primary prevention. The cold chain system maintains vaccines at low temperatures, typically +2 degrees Celsius to +8 degrees Celsius. Heat-sensitive vaccines include OPV and measles. Freeze-sensitive vaccines like Hep B and DPT should never be frozen. The question asks, which vaccine is freeze-sensitive? The correct answer is DPT, which is a T-series vaccine that should not be frozen. The disease frequency that usually occurs at a regular level in a geographical area is endemic. Disability indicators measure the burden and quality of life. Daily, or disability-adjusted life years, measures the total burden of disease. QALY, or quality-adjusted life year, is used in cost-effectiveness analysis. In a final rapid-fire round, we confirm that the numerator is part of the denominator in a proportion. Vitamin A prophylaxis is primary prevention. The most heat-sensitive vaccine is OPV. The time from infection to maximal infectivity is generation time. In summary, epidemiology studies distribution and determinants, centered around the triad of agent, host, and environment. Remember the 4 levels of prevention and the key epidemiological studies: case control, cohort, and RCT. Success is the accumulation of small, consistent efforts. You are one step closer to achieving your dream job in community health nursing. Thank you for watching this video. All the best for your upcoming NORCET and RRB exams.